Hey everybody, this is Dr. Jeremy Payne with Evolution Integrative Medicine in Eagle, Idaho, and today I am with Sarah True. Wait, should I say your last name?
Yeah, that's fine.
I should. Okay.
Sure. Okay.
I am in Eagle, Idaho with Sarah True, and she came into our office with pudendal nerve pain, pelvic floor pain.
Yes.
She was referred from one of our other colleagues that are, that we're really close with. And she worked with my wife for a little bit with chiropractic, some nutrition things, some other services that we offer. And we weren't quite getting the results that we were looking for. So I'm going to just have you tell us a story, basically like where you've been, what you've been going through, and then what you've been doing since then.
Okay, and I'm going to try not to cry. So I've had pudendal nerve pain ever since I had our daughter about 7 years ago. My nerve in my pelvic floor would just throb constantly. The pain level would be from about a 7 to a 9 consistently. I couldn't find, I did various things that would help get the pain level down, maybe to a 5 or a 6, but nothing that was getting to the root issue. So I came here and started getting the injections, and I've had, what, 5 or so? 5?
I think it's been
5 injections.
So it's our 4th one.
4th,
Yeah.
okay. And after the 3rd one, I noticed a huge difference. I've had several pain-free days, and it's just been a godsend in my life.
Yeah, so we are doing right now is doing PIT, which is perineural injection treatment. And we're using dextrose, which is a glucose saline solution, to help with swollen nerves. And we let her know that we started to do that in our office, and she was, obviously interested in that. And so we did start doing the treatments. And I think the first 2 visits, there was a I would say a shift.
A shift, yeah.
Yeah, there was a shift in how dominating the pain was. It wasn't so aggressive. Is that right?
Right. Correct.
And then after we did the 3rd one, I remember we got a message, and you were like, okay, my pain level is a 1.
Yes.
Like it's like a 1 or 2.
Yep.
And then today, she was kind of questioning, like, well, do I even need to do anything because I don't have any pain today, which is really awesome.
Yes.
So, and this has been over probably like about a month since we started that, right?
Yep. Yep.
So, I'm glad that we even started to do this in our office, because I'm so grateful that you came to us and for the referral, but also that you're now literally, like, I would say that you're pain-free at this point. Yeah. And we worked with her today, and we found some more spots, and we're still working on it and creating the healing that her pelvic floor needs. But I know that we're going to get continue to get the results that we're looking for. Yeah. What would you say to anybody, because there's obviously moms having babies every day, and they have these challenges, and they don't know where to go, and they're also doing some crazy invasive surgeries and burning nerves. And so what would you say to the mom that would be searching and struggling and just looking for an answer?
Yeah, I would say to avoid surgery at all costs. There's so many risks that come with surgery. It may not make the pain better. It may cause more issues. So I would say to definitely come in to Dr. Jeremy and get these injections, at least try. I did pelvic floor internal work for a long time, and that would just cause flare-ups. It did not help me. So if you are at a point where you have chronic pain, even if it's not, in your pelvic floor area, I would definitely suggest coming into them and giving it a try. I'm so glad that I did.
Yeah, absolutely.
Yeah.
Well, thank you.
Yeah.
Thank you so much for watching. And again, my name is Dr. Jeremy Payne with Evolution Integrative Medicine. And please remember to click subscribe and like this video so that you can see more just like it. I hope you have an amazing day. And please reach out to us at our office if you need our help. Thank you again.